In this quick case, we're going to use an odd surgical procedure as an excuse to talk about cranial nerve anatomy and pathology. Oh no, what happened to this patient? There's a huge metallic object right on top of his eye with streak artifact all through. Did he get shot? Where did this metal come from? There's another clue here. If we look at the left parotid bed, the parotid gland has been resected. Can we put all this together? So first let's ask ourselves, how do we close our eyes? The answer is there is a circumferential muscle that goes around the eye called the orbicularis oculi. It is innervated by the 7th cranial nerve, and when it squeezes, the eye closes. Okay, then how do you open your eyes? Well, it turns out there's a special muscle for elevating the upper lid called the levator palpebrae muscle. It's part of the superior rectus complex, and sometimes these look like one muscle, but sometimes you can see the differentiation between the superior rectus muscle below and the levator palpebrae muscle above. Like most of the other muscles in the vicinity, the levator palpebrae muscle is innervated by cranial nerve 3. So we have two opposing forces on the upper eyelid. When we want to close our eye, we use the orbicularis oculi muscle innervated by the facial nerve, cranial nerve 7. When we want to open our eye, we use the levator palpebrae superioris muscle innervated by cranial nerve 3, the oculomotor nerve. Okay, let's go back to our patient. This patient underwent a parotidectomy, and unfortunately they had to sacrifice the facial nerve to get an oncologic resection. So we no longer have innervation from cranial nerve 7 to close the eye, but we still have unopposed innervation from cranial nerve 3 to open the eye. So the patient can't blink or close his eye, and the cornea will get dry and ulcerate. To prevent this, we place a small piece of gold under the upper eyelid. When the patient relaxes, the gold weight drags the eyelid down, allowing the eye to close. But when he wants to open his eye, he can still use cranial nerve 3 to raise the eyelid. Nowadays, some of these implants are made from materials other than gold, but we still tend to refer to them all as gold weights for historical reasons.